3,4-methylene dioxymethamphetamine, more commonly known by its street names MDMA, Molly, or ecstasy. It is a synthetic drug that alters mood and perception. MDMA is an amphetamine analog that is both a powerful psychostimulant and a psychomimetic when taken in high doses. The drug can be taken orally in a pill or liquid form, or it can be snorted in a powder form. Once MDMA enters systemic circulation, it acts primarily on serotonin receptors, enhancing the release of serotonin into the synapse. MDMA binds to the presynaptic nerve terminal, where it acts on the serotonin transporter by promoting the release of serotonin. Once inside the nerve terminal, it interferes with the storage of serotonin by promoting its release from the vesicles. MDMA can also promote the release of dopamine and noradrenaline in the same way. Degradation of these neurotransmitters in the synaptic cleft by monoamine oxidase is inhibited, causing a delay in metabolism. Reuptake transporters are also inhibited, which results in an increase of these neurotransmitters within the cleft. These mechanisms of action lead to an increase in the mesolimbic dopaminergic pathway, which results in activation of the reward pathway and increased pleasure. Ongoing positive reinforcement leads to drug dependence and abuse.
MDMA has been considered as a drug of significance when treating post-traumatic stress disorder, or PTSD. One study by Tut4 et al. 2018 conducted a randomized double-blind dose-response trial in a USA psychiatric clinic. The study focused on service personnel over the age of 18 that had chronic PTSD for 6 months or more, and a total clinician-administered PTSD scale score of 50 or greater. The study found that when MDMA was paired with psychotherapy, PTSD symptoms improved. Patients given 125 mg and 75 mg of MDMA showed significant improvements during the first month after the trial. Patients who took 75 mg had a 58.3 improvement, and patients who took 125 mg of MDMA had a 44.3 improvement. Patients who received both MDMA and psychotherapy had an average PTSD score of 87 prior to the study. 12 months after the study, the average score was 39. It was concluded that doses of 75 mg and 125 mg of MDMA with psychotherapy in a controlled setting were effective in reducing PTSD symptoms. Whilst this shows promising benefits for PTSD treatment, patients exposed to continued use can become dependent and as a result develop a secondary medical condition of drug abuse and potential overdose.
PTSD is a mental health disorder that develops in response to trauma after experiencing a distressing event. What happens in the brain during PTSD? PTSD affects two parts of the brain, the amygdala and the prefrontal cortex. When the brain detects a threat, the amygdala initiates a fight or flight response, releasing noradrenaline and adrenaline. If the threat continues, the amygdala communicates with the hypothalamus and pituitary gland to release cortisol. Meanwhile, the prefrontal cortex assesses the threat and either attenuates or calms down the fight or flight response. In PTSD patients, studies have shown that the amygdala is hyperreactive and the prefrontal cortex is less activated. The main idea behind the use of MDMA to treat PTSD lies with its ability to stimulate serotonin receptors. Activity at the serotonin receptors reduces feelings of depression and anxiety, hence increasing levels of self-confidence for the person.
Illegal MDMA consumption is not new to Australia. Around a huge 110% weight increase from national demand by drug report by IC, with 15% of the population taking it monthly. The age targets towards the late 20s, according to the NDSH 2016 survey. Australians are reported to take this drug to stop feeling depressed, stay excited and pleasured, or even enhance a certain event. MDMA addiction reflects badly on the community, especially when mixed with alcohol, ice, and antidepressants, leading to huge side effects such as memory and concentration problems and even death. The drug is illegal to manufacture, traffic, and use according to Section 10 of the Drug Misuse and Trafficking Act in Australia, therefore often sent via international mail and air cargo. The national price for a single MDMA tablet ranges between $4 to $50, with New South Wales being the cheapest state. A lot of news articles have debated in making the illegal drug available to community pharmacies to fix the society's addiction. The Daily Telegraph addresses both sides, with Dr. Dorwick, a harm minimization propedent, explaining if available in pharmacy, pharmacists are able to explain how to minimize a risk and therefore make it as low risk as possible, while spokesperson for the Pharmacy Guild states that it is very unlikely that such a drug will be improved by the TGA.